you feel old, and that has been the model for most of the
throughout
men.
history, doctor.
Yeah.
You're absolutely right. That's an adage that we've said many a time on our interviews here. When you look better, you feel better.
Absolutely.
And I wanted to ask you, Dr. Hormozi, how safe are these procedures?
In an experienced hand, all these procedures are safe. But the key is in experienced hand.
A board-certified doctor who has experience,
And does
like
a lot
yourself.
of it. And does a lot of it.
Yes.
The more you do, the easier it becomes, the safer it becomes. There's always risk involved with any type of surgeries, but I'm thankful that in 16 years I haven't had a single complication. And that says a lot about how safer they are. The way I do it, I use techniques which are state of the art. I don't use blade anymore because we can reduce the bleeding. We can make the incisions much softer, nicer looking, faster healing.
And you do it all under local anesthesia. The patient's still awake.
Absolutely.
And I think that says a lot. And certainly having researched yourself before we had you on, doctor, you have an impeccable reputation, and you're certainly among, if not the top, ocular facial plastic surgeon, not only in this area, but in the country. And we're certainly really appreciative of you coming on today.
Thank you.
Now, we have more to talk about with you, but before we get to that, we have a patient that we're going to be meeting, I understand, here next, who actually had undergone a procedure recently from you.
She's a prime example.
We're now going to meet one of Dr. Hormozi's patients. Welcome, Jennifer.
Hi, how are you?
Oh, great. It's a pleasure having you on, and we really appreciate you taking the time to come down and about to share your experience that you're going to be sharing with us here.
Yes.
Well, let me just start right off the bat by asking you if you could please tell us, what did you have done?
Well, if you can't tell, I've had my upper lids and lower lids done about 5 years ago.
Really?
Yes.
They look your eyes look beautiful.
Thank you.
And why did you decide to have that done?
Well, I had puffy lower lids, and I had a little bit of skin sagging down on my upper lids, and I felt at the time, I was 32, that it was easier to get it done early than wait until you needed everything done.
So you were proactive. You actually, like most people out there, might want to wait on something like that until they get a bit older. But in your case, you just felt, hey, listen, I don't feel right, or I don't feel as confident. You noticed it, and you just said, I want something done, and you came to Dr. Hormozi.
Absolutely. I believe that if you can get a little bit done each and every time that you see something that's not right, and then come in and get it done, that way you don't have to wait until you're older.
Exactly. Now, how long did this procedure take? Was it one procedure, or was it over a couple of visits, or what was involved?
It was one procedure. I was very excited. I came in that day, and I was in and out in about 40 minutes.
That's it?
That was it. Few injections to numb the area. I was awake the whole time. The doctor spoke to me, the nurses, we laughed and carried on, and I was out the door in like about 40 minutes.
So basically it's something that wasn't that time consuming whatsoever. I mean, 40 minutes, that's something you can even have done, during lunchtime.
Sure. Well, you may not want to go back to work afterwards.
Sure.
But it wasn't very painful at all, and the recovery was very quick, about maybe 5 days of swelling, and the bruising you can hide with makeup afterwards.
That's it.
That was it.
And as far as any follow-ups, Jennifer, did you have any follow-up visits after the procedure?
I did. About 6 days later, I came back, and everything was perfect. And about 3 months later, when everything was completely healed and done.
And I take it, based on what you sound like and certainly appear like today, that you're very pleased with the results?
Absolutely. Absolutely.
And
I would encourage any young woman that is thinking about doing it to absolutely go ahead and do it, because it's worth it. You don't want to have to wait, and you can have all 5 years, and now I'm completely happy, and 5 years of stuff that I could have been like trying to hide and buying all kinds of products that I really probably wouldn't work.
Exactly. Well, let me tell you right now, you look beautiful,
Oh,
Jennifer.
thank you.
And we really appreciate you taking the time and coming down and sharing that experience with us.
Thank you, Rocco.
Oh, thank you. It was our pleasure for having you on as a guest on A New Me.
Thank you.
We're now back with Dr. Hormozi. I must say, Jennifer seemed very pleased with the results.
Thank you. Well, she's a patient who was concerned about the look of her age. She didn't like to look old when she is young. So the surgery, what it did, give her back the younger look, fresher look, as I mentioned before. Removing the bags on the lower lid gives the fresh look, the young look of the upper lid, and also her personality just comes through.
That's right.
The way she looks.
That was a pleasure having her
Absolutely.
on. Now, let me ask you, Dr. Hormozi, if you could please take a few moments to tell us about the benefits of utilizing Botox injections to supplement, whether it be eyelid surgical procedures like you've described today, or maybe just Botox on its own? Because we all have heard about Botox.
Absolutely. It's a big attraction for people, the Botox. Botox actually is, as the name is, botulinum toxin. It's not an infection. It's not something that you create in the patient. It's a chemical which was created in the lab and is injected into the muscle. Any muscle injected by that gets paralyzed. So it's used around the eye by removing the wrinkles of the forehead, the frown line, which people don't like to have because it gives them a very angry look, or in the corner, outside corner of the eye, they don't like what we call crow's feet. So the injection of the Botox can be part of, after the surgery. I usually don't do it at the time of surgery, but after the surgery or just by itself. People who don't have bags or droopy upper lid, but they just don't like the frown.
Yeah, they have some wrinkles or frowns.
Exactly.
But like you said, don't have the droopiness or the bags. For the surgical procedure, they could actually benefit from just Botox.
Absolutely. Botox has a limited action. It takes about 4 months and it wears off. So it is something that needs to be done again and again, but patients love it. Now, in long term, in my experience, I noticed that the wrinkles and frown lines gradually disappear. The reason for that is patients have been exercising those muscles over the years. That's why their frown line is worse than others because they have very bulky muscle. When you inject those muscles, gradually they get weaker and weaker, and after a while they don't need injection. They have their own expression, but they just don't look angry all the time. And that makes a difference.
Yes, it does, a big difference. Now, before we let you go, Dr. Hormozi, I have to ask you, you certainly, as I mentioned initially, before this interview began, when I was letting the audience know about a bit about your background and some credentials, you speak nationally, you lecture nationally on bladeless radiosurgery. And I have to ask you, that's something that's very cutting edge, and you're the only one in this region, certainly that I'm aware of, and I've interviewed hundreds of doctors over the years in various specialties, and certainly several plastic surgeons, and you're the first regarding bladeless radiosurgery. Can you please, before we let you go, tell us and educate us on that cutting-edge procedure?
Sure. Any type of surgery can be done with 3 different instruments. One is blade, which is the old-fashioned blade that you cut through the skin or whatever tissue you have to. The second one is laser. Laser cuts through the skin and also cauterizes blood vessels, so it minimizes the bruising after the surgery. The third one is using radio wave, and that's the one I use. Radio wave has advantage of cutting through the skin or the fat or whatever tissue I'm having surgery on, and cauterize at the same time, so you minimize the bruising after the surgery. It's a very accurate cut because it doesn't drag the skin. It's done through a radio wave machine, which I have a wand in my hand and an antenna behind the patient, which is not even attached to the patient, so it's safe even if they have pacemaker. It doesn't make any side effect on their pacemaker. And as I'm drawing, it cuts, so it gives a natural, no drag effect, and cauterizing at the same time. The beauty of this surgery is I don't have to shield the patient's eye or my eye or anybody around me, because laser can bounce and reflects. As you know, it's a light. Right. Radio wave doesn't bounce, doesn't do anything, doesn't have any side effects, so it can be safely done to the patient without having to protect everybody, surgeon or patient or surrounding, and get perfect results and the ideal result that we want, with a very fast recovery with minimal downtime and minimal bruising.
Well, that was certainly very interesting and very enlightening. And on that note, I'd like to thank you, Dr. Hormozi, for being a guest and joining us today on A New Me.
Thank you very much.